This book breaks down the way that we conceptualize patients into 4 different steps: learning, thinking, matching, discussing. In learning, we really talk about listening to the patient. Different types of therapists think about this differently. Some use the term history of present illness, some think about a past psychiatric history. But in writing this book, we wanted to appeal to all different types of therapists, and some therapists don't think about it that way. And so we just called it learning about the current issues and the life story. Next, we have thinking. And some therapists think about this as creating a formulation, but that's a very specific thing to specific types of psychotherapy. And so, again, we wanted to broaden this. And so, when we think about thinking, we think what's wrong, why is this happening, what needs to change, and what resources are available. Next, we have matching, and that's putting everything together with the story and the conceptualization of what's wrong, the patient's needs, what the patient wants to get out of treatment, and matching it to optimize care. Finally, we have discussing, which is incredibly important because you want to be able to tell the patient why you're recommending what you're recommending instead of having it be some sort of mystery to them. And this can be used at all stages of treatment. It can be used at the beginning when somebody comes into the office, and it can also be used later on in treatment when something feels stuck, to just kind of recalibrate, rethink about what's going on, apply these 4 different steps to thinking about the patient, and either deciding that the treatment is not optimized or that perhaps it is and that it just needs to keep going. And I think this can be helpful for people that are starting out, and it can also be very helpful for people that have been doing this for a long time. Instead of them thinking that everybody should fit to the type of therapy that they offer, they can really think about every new patient or every patient that they're treating as somebody who may benefit from what they have to offer or may benefit from something else. And I really think that if people continue thinking about these 4 steps and remain interested in having this stance throughout the time that they're in practice, they can really optimize the care that they can provide. The care is going to be best if it's the right treatment for the right patient.
And I think this idea of being open to activating this cycle has been really important for me to think about. I mean, it again, rather than thinking, am I not doing a good job anymore? Or if a patient's been seeing you for a long time and something's up, it may be that it's time to shift, and or that they may, for some period of time, they may need to see another kind of therapist and come back. So really being open to this and being open with the patient that, well, something's up, let's think through the cycle again. Let's think about what's happening now and how we might match it to the treatment that would be optimal at this time.